Okay, so in this section, we are mainly dealing with blood coagulation. Blood coagulation basically means blood clotting. That is the meaning of the word blood coagulation. You might have heard about the term blood coagulation for a long time. Okay, so what is the basic purpose of blood clotting or blood coagulation? The first sentence very clearly explains that. The purpose of blood coagulation is to stop bleeding. When some kind of injury or is happening on the surface of your skin, blood will be coming out from that injury, site of injury, or point of injury. To prevent the flow of blood, there should be some mechanism, and body is using a mechanism known by the name blood coagulation. There is another term called blood clotting is also used. Now, what is the basic process that is taking place in a blood coagulation? That is what is mentioned in the second line. It is to convert the plasma protein fibrinogen into fibers. This is the basic mechanism that is happening during a blood coagulation. That there is a kind of protein in the blood. That protein is known by the name fibrinogen. Okay, this fibrinogen is in a soluble form that we cannot see because it is dissolved in the blood. It is soluble protein. That soluble protein will be converted into an insoluble protein. Then it is known by the name fibrin. So this is the basic process that is taking place during blood clotting or blood coagulation. Converting a soluble protein known by the name fibrinogen into an insoluble protein. Or simply we can say that during a blood coagulation, fibrinogen in the blood will be converted into fibrin. The nature of the fibrin is that it is a network-like structure. And in that network, blood cells can be easily trapped. So that is how the blood clotting is normally taking place. So fibrinogen will be converted into that, and this fibrin can stick. It's a sticky protein. That means it can attach to the wall of the injury, injury, so that it can form a network-like structure there. And in that network-like structure, blood cells and platelets become stuck, or they will be getting trapped and forming a clot-like structure or a seal-like structure, which will be preventing the leaking of blood to that injury, site of injury. So that is what is happening during a blood coagulation. So basically, the fibrinogen will be converted into fibrin. Fibrin into a network-like structure. In that network-like structure, blood cells and platelets will be trapped. Now, what happens? What are the other three processes that we are involved in the bleeding? There are three main processes the body is using to prevent the bleeding or to stop bleeding. So these are the three other processes. One is vasoconstriction, platelet plug formation, and third one is the clotting. These are the three main mechanisms that we have to see. So we have to first understand what is the meaning of the word vasoconstriction. Vaso means blood vessel. Okay, vaso means blood vessel. It can be either artery or a vein. And constriction means contraction. So the by which vasoconstriction, the size of the artery will be gradually reduced. So that is the process that is taking place during vasoconstriction. So when an injury occurs, the blood vessel constrict. I will show you a picture of that. Here you can see that this is the normal artery, and this is the constricted artery, and this process is known by the name vasoconstriction. Here what is happening? It is an opposite process is taking place. It is that blood vessel is dilating, and that process is known by the name vasodilation. So vasoconstriction means contraction of the blood vessel. Vasodilation means dilation of the blood vessel. So or dilation of the artery. So that mechanism is known by the name vasoconstriction. During any bleeding, this is the first mechanism body is resorting, because body will be contracting or constricting the diameter of the blood vessel, so that less blood will be moving out of the body or out to the site of injury. So when an injury occurs, blood vessel will be contracting or constricting, causing reduced blood flow to the site of injury. So if more blood is coming to the site of injury, more blood will be lost from the body. So what body is doing is that will be reducing the diameter, reducing this diameter of the blood vessel, so that less blood will be coming to the site of injury. Then another process is known by the name platelet plug formation. I think in the last class we have studied about platelets plug. Platelets are very small cells without a proper nucleus, and these platelets will be coming together and will be clumping together or sticking together at the site of the injury, forming a plug-like structure or a cap-like structure. That plug or cap-like structure formed by the grouping of or aggregation of many platelets is known by the name platelet plug. So platelet plug can also block the site of injury, so that less blood will be moving out of the body. So platelets also activate the process which causes fibrin clot to form, and known as secondary hemostasis. That is, platelets have another function. What is the basic process taking place in a blood clotting? Conversion of the fibrinogen into fibrin. That is the basic thing. In any blood clotting, fibrinogen will be converted into fibrin. Fibrin is in the form of the net, and in that net, blood vessels and platelets can be trapped. So that is how the blood clotting is normally taking place. So during the platelets can also have another function. One function of the platelets is to form a platelet plug. Second function is that it can cause fibrin clot to form. That is, the platelets can also cause the conversion of fibrinogen into fibrin. So that is another function of the platelets. One function is to formation of platelet plug. Second function is the formation of or conversion of fibrinogen into fibrin. So these are the two functions of the platelet plug. Now there are a number of other factors. Other factors mainly means, in addition to this fibrinogen and platelets, very small proteins are involved, and these proteins are known by the name clotting factors. Clotting factors means these are very small proteins. Their purpose is to help in the mechanism of the clotting, and that is why they are known by the name clotting factors. So if you ask for a definition, clotting factors are simply small proteins which are assisting or helping in the clotting process. That is known by the name clotting factors. And these clotting factors are usually given number 1 to 13. That is clotting factor 1, clotting factor 2, like that up to 13 clotting factors are there. Here you can find the list of the different clotting factors. The first clotting factor is fibrinogen, the second is prothrombin, and the last one is the fibrin stabilizing factor. So there are 13 proteins or 13 clotting factors which are helping in the process of clotting. That is why they are known by the name clotting factors. So these are the important type of clotting factors, and their nature, their source, as well as their function. Most of these clotting factors are produced in the liver. Here you can see that liver is the important source of most of the clotting factors, and some are also produced in the plasma. So going to the clotting factors, clotting factors are helping in the process of clotting, and they are and they are given a name from clotting factor 1 to clotting factor 3, and these factors activate each other in what is known as clotting cascade. That is clotting cascade. Here that means when clotting factor 1 is activated, that clotting factor will be activating the second factor known by the name clotting factor 2. When clotting factor 2 is activated, that will be activating the clotting factor 3 known by the name tissue factor. When third clotting factor is activated, that will be activating the fourth clotting factor. This mechanism is known by the clotting cascade. Clotting cascade. That simply means clotting cascade. So that is clotting factors are sequentially activated one after other. When first is activated, second will be activated. Second will be activating, triggering the activation of third. Third will be triggering the activation of fourth. Fourth will be causing the activation of 5. Fifth will be acting in the, triggering the activation of 6. Up to like this, up to 13 clotting factors can be activated in a step-by-step manner. That process is what is known by the name clotting cascade. So there is a term called clotting cascade. In clotting, the clotting process is taking place in a sequential manner, and that sequential manner is known by the clotting cascade. Now, end result of this clotting cascade is that fibrinogen, a soluble plasma protein, is cleaved. Cleaved means split into fibrin and a soluble plasma protein. The fibrin will be sticking together to form the clot. So, this formation of fibrin is actually taking place at the last step. There are 13 clotting factors. Only at the last step of the clotting cascade, the formation of fibrin will be completed. So that is how the clotting cascade is normally taking place. Now the clotting cascade occurs through two separate pathways. So we have now already seen that what is clotting factor. Clotting factor simply means a group of several proteins helping in clotting. Since they are helping in clotting, they are known as clotting factors. And they are activated one by one. First is activated, will be causing second to activate, second will be causing the activation of third. So in a step-by-step manner or in a sequential manner they are activated, and that process is known by the clotting cascade. Now there are two important rules or pathways for this clotting cascade to take place. That is what we are going to study. There are clotting cascade occurs two separate pathways. One is intrinsic pathway and second one is the extrinsic pathway. That is what we have to see here. So there are two pathways are shown here. The first pathway is known as extrinsic pathway. Second is known as intrinsic pathway, and there is also a common pathway. So what is happening in the extrinsic pathway is normally activated by external trauma. External means outside. Some kind of injury taking place on the outer side of your skin or on the outside of your body. Or that is known as external trauma. Trauma simply means injury. Some accident is causing bleeding from your body or any part of the body. That is an external trauma that causes blood to escape from the vascular system. So that when some kind of bodily injury is taking place, there is loss of blood from your body, that can be considered as an external trauma, and this pathway, known by the name extrinsic pathway, will be working. So the advantage, the one peculiarity is that this is very fast, quicker than the intrinsic pathway, and it also involves a factor known by the name clotting factor 7. That is clotting factor 7. Here you can see that is pro-converting. The clotting factor 7 is involved. What is the function of pro-converting? The pro-converting is actually helping in the conversion of the fibrin or thrombin into prothrombin into thrombin. That is one important function of the pro-converting. So In the use of this extrinsic factor, this clotting factor 7 or pro-converting is involved. Now the second factor is pathway is known by the name intrinsic pathway. So this is intrinsic means internal. So that you can, extrinsic means external. You can use use in that way also. Intrinsic pathway is activated by trauma inside the vascular system. That is, when some kind of injury is taking place inside your artery or inside your blood vein, that is an internal trauma or internal injury. So intrinsic pathway is actually caused by internal injury or internal trauma. So that is a peculiarity of intrinsic pathway. So internal trauma is causing that, and it is usually activated by platelets, exposed endothelium, chemicals or collagen. So normally a intrinsic pathway will be activated when some kind of internal injury is taking place or inside your artery or inside your blood vessel. Now peculiarity of that, it is much more slower than the extrinsic pathway. This is faster and this is more slower. Here 4 proteins like clotting factor 12, clotting factor 11, clotting factor 9 and clotting factor 8. These are the 3 clotting factors which are involved only in intrinsic pathway, whereas clotting factor 7 is only involved in extrinsic pathway. Now here I will show you one picture. See, this is the extrinsic pathway and this is the intrinsic pathway. Here you can see that the clotting factor 7 pro-converting will be converted into the active form. So that is normally caused by a mechanism for any kind of trauma, external trauma. So this is the extrinsic pathway. Now as a result of that, the factor 10, the clotting factor 10, what is clotting factor 10? Clotting factor 10 is Stewart factor. The Stewart factor will be activated. So in the use of extrinsic pathway, clotting factor 7 will be activated, which will be activating a factor, clotting factor 10, otherwise known by the Stewart factor. Now if you look at the second pathway, that is internal pathway taking place inside the blood vessel, it is known as intrinsic pathway. In the use of intrinsic pathway, number of factors are there. One is 12, other is 11, 9 and 10. So these are the 4 proteins which are involved in intrinsic pathway. 12, 11, 10. So what is the name of the 12? The 12 is known by the name the proplasma antiman factor, then 11 plasma thromboplastin, then 10 Stewart factor, then plasma thromboplastin common, PTC. These are the names of the different proteins which are involved in second pathway known by the name intrinsic pathway. So intrinsic pathway is shown on the left side and extrinsic pathway is shown on the right side. Now what happens is that both intrinsic pathway as well as extrinsic pathway is actually merging at this level. At the level of Stewart factor, so both pathways are meeting together, and that will be causing the conversion of prothrombin into thrombin. Prothrombin is actually inactive form of an enzyme, and thrombin is the active form of the enzyme. It is this enzyme known by the name thrombin that is converting fibrinogen into fibrin. So conversion of the fibrinogen into fibrin is actually taking place at the very last step of it. And for that we need an enzyme. That enzyme is known by the name thrombin, which will be formed only if these 2 factors, these 2 mechanisms have operated. In the absence of either intrinsic pathway or extrinsic pathway, this conversion of prothrombin into thrombin will not take place. So that is the peculiarity of the clotting cascade. So it is actually taking place in a step-by-step manner towards the last step we are saying fibrinogen will be converted into fibrin, and fibrin will be forming a cross-linked network that will be trapping blood vessels and platelets, forming the blood clot. So these are the mechanism by which the clotting pathway is operating. So here there are three pathways are the extrinsic pathway triggered by external injury, intrinsic pathway caused by internal injury, then third is the common pathway. Both pathways meet and finish at the pathway of clot production in what is known as common pathway. In the common pathway, number of clotting factors are involved. Clotting factor 1, 2, 5 and 10. These are the protein factors or clotting factors which are specially present in the common pathway. So if you get a question, distinguish between extrinsic pathway or intrinsic pathway or comment on common pathway, you have to mention about these four clotting factors. Then we have already seen that what is the meaning of the clotting cascade. Clotting cascade is simply a chain reaction. One factor is activated, that will be activating the second, and that chain reaction is known by the clotting cascade. Then we have the cardiovascular diseases and blood pressure that we will be discussing in the next class. So today we will finish with the blood clotting. Remember that in the case of blood clotting, there are two important mechanisms. One is vasoconstriction, third one is the platelet plug formation, and the third one is actually known by the name clotting. And clotting is actually taking place through a series of mechanisms, like clotting factor is involved, clotting cascade is involved, then three pathways are involved, intrinsic, extrinsic and a common pathway. So if you explain these things, the topic on the clotting will be over. So so today we will be stopping here. In the next class we will be discussing the different types of diseases affecting the blood vascular system.